Perfect. Thank you so much.
You're very welcome.
So next slide. As Katie mentioned, I'm counsel to Aimed Alliance. We are a not-for-profit organization that seeks to protect and enhance the right of healthcare consumers and providers. Next. In today's presentation, we will be going over the statistics of migraine disease in the workplace, discuss federal protections, including the Americans with Disabilities Act, as well as the Family Medical Leave Act. We will also provide an overview of other benefits such as short-term and long-term disability, and end the discussion with the Social Security disability insurance. As you can imagine, employers have a vested interest in the health and well-being of their employees. They want them to be able to show up and be productive. It is in their best interest to create a welcoming environment for their employees with migraine disease, including by offering sufficient benefits. Migraine disease impacts individuals during the majority of their working career, with the most common age being between the ages of 25 and 55. Yet, during a migraine episode, more than 90% report being unable to work or function normally. 51% report that their productivity level is cut in half. Migraine disease also results in significant financial burden and losses for employers. For example, over $13 billion lost dollars from reduced productivity each year and 113 million lost workdays due to this disease. Therefore, it's vital for employers to take steps to offer accommodations to mitigate the onset of migraine episodes and benefit to assist when employees experience these episodes. Next slide. Of course, not all employers do offer comprehensive benefits. However, even so, individuals with migraine disease may be protected under certain federal laws. First is the Americans with Disabilities Act, which is a federal law that protects against discrimination in the workplace, among other things. It applies to private employers, state and local government, employment agencies, labor unions with 15 or more employees. These entities cannot discriminate in hiring or the firing process. It's important to note that not everyone with migraine disease will be considered to have a disability, because disability is determined on a case-by-case basis rather than based on a list of conditions. Next. Under the Americans with Disabilities Act, employees must be both a qualified individual and have a disability. Disability is defined as impairment that substantially limits one or more major life activities, such as the ability to work or care for oneself. Major life activities include things such as performing manual tasks, seeing, hearing, eating, sleeping, walking, standing, concentrating, thinking, communicating, working. An individual is considered qualified if he or she is capable of performing the essential duties of the job with or without an accommodation. Essential duties are tasks that are fundamental to the position. Ancillary duties do not count. However, employers have a lot of leeway in determining what is considered essential. Even if you have a disability, an employer can still decide not to hire or to fire you in certain circumstances. These include failing to meet the definition of qualified individual, so you can't perform those essential functions. You pose a direct threat to health or safety to yourself or to others. The reason for not hiring or firing is completely unrelated to the disability. A direct threat is defined as a significant risk of substantial harm to the health and safety of an individual or others that cannot be eliminated or reduced by reasonable accommodation. For example, if you're a truck driver and you get a migraine episode with aura, when your vision is impaired, you may pose a direct threat to the safety of yourself or others. I think you're already on the next slide. Yeah, no worries. There's some things that employers are not permitted to do, although there's some exceptions here too. They're not supposed to make disability-related inquiries or require a medical examination as part of a job application or job unless those inquiries are shown to be job-related and consistent with business necessity. An employer can require a medical examination or inquiry only after making a job offer and before the applicant begins work. An employer may also condition an offer of employment on the results of an examination or inquiry if all entering employees in the same job category are subject to the same examination or inquiry, regardless of the disability. Next slide. Employers can and should request, employees can and should request reasonable accommodation, which is a modification or adjustment to a work environment. Accommodations must be provided to qualified individuals unless doing so would cause undue hardship. An accommodation is an undue hardship if it would cause significant difficulty or expenses to the business. But a majority of these accommodations they cost less than $500. So for most employers, that makes them reasonable and quite easy to implement. Next slide. So what are reasonable accommodations? They could be everything that may be reasonable during a migraine attack to limit triggers. So light, sound, scent. It could be something like alternative lighting, noise canceling headphones, anti-fragrance policies, flexible schedule, ability to telecommute. Employees must request these accommodations. They can present it via a note from your HCP, and you will see this message throughout this presentation. Document everything as you're asking for reasonable accommodations. Next. Not everyone with migraine disease has a disability. However, 90% of individuals with a migraine disease cannot function normally during an episode. According to the World Health Organization, it is ranked as the 6th highest cause of disability worldwide. And it impacts major life functions, including sitting, standing, seeing for hours. Next. This is one case that I wanted to present to you guys. This was an employee that worked as a sales representative. The migraine episodes left him temporarily incapacitated, which impaired his workability and his life activities generally. Around the same time, the employee received poor performance reviews. He submitted a doctor's note stating that employee's migraine disease could result in serious health consequences. Work-related stress was a trigger, and absent change in current environment. Medical leave of absence alone would not significantly mitigate his stress. His requested accommodation was to be permitted to perform his same job under different supervision. Essentially, he wanted to move to Asia and work there. The company denied the request, and following subsequent poor performance review and written warning, they ended up firing him. He sued for discrimination under the Americans with Disability Act. The court ruled that his inability to perform a single particular job does not constitute a substantial limitation in major life activity for working. Rather, he needed to show that his condition precludes him from working in a class or broad range of jobs. Because he admitted he could do the same job so long as the supervision was different, the court ruled that his condition was not considered a disability in a major life activity of working. So the takeaways here is that the court is not always going to find migraine as a disability. And also, you have to be reasonable when you're requesting accommodations. Next. So what happens if your accommodation is denied? First step you can do is ask why or whether the accommodation requested was unreasonable. So for example, if you're working at Nordstrom and fragrances bother you during a migraine episode or a migraine attack, but there's no way that the department store would be able to implement an anti-fragrance policy, but could they move you to a different part of the store? If denied your accommodation for unknown reasons, go up the chain of command. Be sure to document all of your interactions, preferably in writing. If you are unsuccessful, you can file a complaint all the way up to the Equal Employment Opportunity Commission or even the state's enforcement agency. If EEOC dismisses the charges, then the final attempt could be to file a lawsuit. So now I wanted to go a little bit over the Family Medical Leave Act. So what is that? This guarantees employees the right to take unpaid leave for certain urgent situations. That's usually dealing with a serious health condition or caring for a family member with serious health condition. It provides 12 weeks of unpaid leave in a 12-month period. This period does not need to be consecutive. It guarantees health insurance coverage during this period of absence, and employers cannot interfere with, restrain, or deny exercise of any right guaranteed by the FMLA. So next slide.
Oh, sorry.
No worries.
Here it is.
So who does FMLA apply to? It applies to an employer with 50 or more employees. The employee has worked for 12 months within the previous 7 years. Employee worked 1,250 hours during the 12-month period. Employee worked at a site with 50 employees or where the employer has 50 employees within a 75-mile radius. Next slide. To request leave and protect your health benefits, you must provide your employer with adequate notice. That's usually at least 30 days in advance unless the situation is an emergency. And you must submit medical certification from healthcare provider if leave is due to a serious health condition. And this is why, again, documentation is very, very important. If an employer has retaliated against you because you took time off and you provided proper notice or requested leave, you can file a complaint with the Wage and Hour Division of the Department of Labor, or you can obviously sue the employer directly. You have up to 2 years to file a lawsuit, and that 2-year limitation starts from the date of the retaliation and is not extended if you decide not to file a complaint with the DOL, with the Department of Labor. Next slide. Oh, sorry. Many employers also offer short-term and long-term disability policies. You can also purchase a policy through an agent if your employer doesn't offer one. Short-term disability is typically offered for a 90-day period, but the policy can range anywhere from 30 days up to a full year. You should be aware that short-term disability plans have a requirement for how many days you need to be out of work before you can claim the disability. It's usually called an elimination period. The reason for this is that they don't want to invoke short-term disability for something that could be covered by your company's sick days. Long-term disability usually starts after you've exhausted your short-term plan. So there may be a waiting period of 3 to 26 weeks, taking into account the typical short-term policy. Long-term disability typically covers 2, 5, or a 10-year period, or until you reach the age of 65 or 67. However, the plan may also require you to sign up for the Social Security disability insurance, and sometimes they will help you enroll as well.
Sorry, I might be 2 slides ahead, but it won't let me go back.
Oh, no worries. I can just go over the next. So what is considered a disability? The definition of disability will be defined by the policy and can vary from one policy to another. However, usually it is a condition that renders you unable to do your job. You will usually receive a percentage of your salary. Most commonly, it's 50 to 70%, up to a certain dollar amount, which is usually the cap. However, your employer may choose to set it up in a different way. You will also need to submit paperwork to use those disability benefits, and the paperwork required will depend on the terms of your policy. So it may require a medical record, a note from your doctor, and then update from your doctor visits. So this slide now, some individuals have difficulty using their disability benefits because migraine is not easily diagnosed. You will need to prove that migraine disease limits your ability to work. For that reason, it's very important to document, again, everything in a detailed migraine journal, include dates, all of your symptoms, which dates you had the migraine attacks, and how they impacted your ability to work. You can also gather supporting documentation from your doctor, including your medical records. The more written evidence you have to support your disability claim, the better. Next slide. Make sure all of your medical records are complete and up to date, and they should include physician notes about the frequency, intensity, severity of the migraine attacks, results of any tests, medication and treatments, records of any ER visits, and have clear documentation of how many hours and days of work was missed due to migraine disease. Finally, I wanted to go over the Social Security disability insurance. This typically covers around $15,000 per year. Several criteria, though, need to be met. There needs to be a showing that you're unable to work and earn gainful living. You or a family member must have had a recent job and paid into the program. You must prove that you have a medically determinable impairment, medical condition that will last at least a year or might result in death and limits ability to be employed. Provide evidence of severity of condition, so test results or medical records. Next slide. Demonstrate your level of impairment. So you must show that a condition is equal to a condition that is in the Blue Book. Unfortunately, migraine disease is not in the Blue Book. The closest condition is epilepsy. Only about 15% of individuals with epilepsy who apply for disability under this are even approved. Those with migraine disease have a harder time, as you can imagine, getting approved for disability and retaining benefits under this specific policy. But it is getting easier. Only about 3% of people who apply for the Social Security disability insurance do so because of migraine disease, and are half as likely to have an application approved as those with different disorders. But as I said, it is getting easier. The Social Security Act recently released a guidance. If you are denied claims under this insurance, then you can appeal its findings. So next slide. This is the portion of the guidance that I was referring to by the Social Security Act. I recommend looking at this in its entirety. You can usually search for chronic, it's the top thing, chronic migraines and Social Security disability, applying for Social Security disability benefits, and the guidance comes right up. Next slide. And finally, Aimed Alliance also has some resources at aimedalliance.org on migraine disease in the workplace, and we hope that you check those out as well. That's it. Thank you.
Thank you.